Welcome to Health System CIO's interview with Kristin Myers, Executive Vice President and Chief Information Officer with Mount Sinai Health System and Dean of Digital and Technology. I'm Anthony Guerra, founder and editor-in-chief. Kristin, thanks for joining me.
Thanks, Anthony, for having me.
All right, very good. You want to start off, tell us a little bit about your organization and your role.
Sure. So Mount Sinai Health System was created from a merger of Mount Sinai Medical Center and Continuum Health Partners in 2013. It comprises of 8 hospital campuses in the New York metro area and also the Icahn School of Medicine. So around 9.3 billion in revenue, and we have 43,000 employees. My role is Chief Information Officer and Dean of Digital and Technology. And, I am continually looking at optimizing and modernizing and really innovating so that, we can enable the health system's mission and also increase our competitive advantage in the marketplace. So, I've got a wide scope of responsibilities that really span digital enablement, cybersecurity, enterprise data and analytics, innovation, informatics, service delivery, applications, the cloud infrastructure, and also the IT program management office. So anything technology related falls into my purview.
Very good. Excellent. All right. Well, what caught my eye was a press release that went out for some very interesting topics in it. Has to do with a company called Sandbox AQ, quantum tech, AI. It's a collaboration. You're launching post-quantum cryptography solutions. I was kind of blown away by that. I hadn't seen a lot of things come out around that kind of topic, so I wanted to jump on the phone with you, or Zoom as it were. So what can you tell us about, if you want to start out by describing the issue that then this is part of your solution to, what is the core problem that this project relates to?
Sure. So if you think about the amount of confidential information that health systems have, such as PHI and financial information, that's protected today with encryption methods, traditional encryption methods. They can be broken very quickly as quantum computing develops. So, really in theory, a bad actor can, collect encrypted communication streams and then decrypt them when they have this technology. And so that would be pretty harmful for health systems, around information like PHI or his social security number. And so, the whole idea around this post-quantum cryptography is really around developing a system that's secure against both quantum and classical computing. And so, can interoperate with our existing protocols and networks. So, over the next year, we're working with Sandbox to inventory and really assess all of the encryption methods that we're using in the health system, and then identify, methods that would be impacted by quantum computing. And so they'll give us some options around that to address the risks. And, we see this as, quite a long-term partnership with them. This isn't a problem, for today, but certainly is a problem that will occur in, the next 3 to 5 years.
How does something like this get initiated? Is this you initiating it, saying there's an issue here and I'm going to move forward with addressing it, or did it surface from somewhere else in the organization?
Yeah, it actually surfaced from somewhere else in the organization. Mount Sinai is known as, extremely innovative. And, when, Sandbox, contacted our organization, we did a review. We looked at, what was the marketplace like? What problems were we trying to solve? The White House had just actually released a memo around quantum computing and readiness of federal agencies around this exact problem. So if you think about, we're an academic medical center, we work very closely, with the NIH. It's a matter of time before, this type of technology, needs to be adopted with AMCs. So we thought it was a great idea to at least start the process and learn with an organization like Sandbox, who are extremely innovative as well.
So you think this is going to be at some point within the next few years, sort of a stakes to play kind of technology on the security side?
Yes, yes.
Have you,
Um,
do you know if, what's your sense of what percentage of health systems are starting down this road? Do you think you're sort of on the cutting edge here, or do you think there's a general movement to address this?
No, I think, we're probably, one of the early adopters around this who, are really, looking at this. And, I think it goes back to, the fact that, again, we're an innovative organization as an AMC, but we also have a CISO from outside of industry. And, he's able to, really bring, best practices and, he looks at technology in a very different way. And, he was very excited about, partnering with Sandbox, as was I. And, thought that, long term in terms of our cybersecurity maturity, that it's important for us to start looking at some of these novel technologies.
You mentioned Rishi Tripathi, who started as your CISO in May 2021. So May of last year, been there about a year.
Yes.
Comes from outside of healthcare. So that's interesting, right? Were you sort of the head person in charge of that hire?
Yes,
Okay.
absolutely.
So
Yeah.
what were your thoughts there? And when you were making that selection process, it's easy to sort of play it safe, so to speak, or maybe it's not even playing it safe these days to go from inside of healthcare. You decided to go outside. What was your thought process? What were you looking for?
Yeah. So, when I became CIO 2 years ago, it was clear to me, we needed, a more mature cybersecurity capability. I think that, as we invest more as part of our overall digital transformation, you look at other industries who've already gone through this, like retail and finance, and, their investment in cybersecurity is much higher than traditionally healthcare has invested. And so, from my perspective, I wanted to make sure we had a very strong and capable CISO. And, that was, really what I was focused on. I looked at, leaders in healthcare and leaders outside of healthcare. I wanted to make sure that, whoever we brought in had, tremendous cybersecurity experience, a very proactive risk management mindset, and was a business leader as well, not just a technology leader. It was important that they could speak appropriately, to our business stakeholders and partners, communicate the importance of cybersecurity, and make sure that, cybersecurity is not seen as an impediment to the business. And I think that, he's made tremendous progress in less than a year. He's significantly matured our cybersecurity program since he's joined. And, I think he's an amazing leader, and, happy that, we were able to find someone of that caliber.
Did you have a specific plan to get him familiarized with the healthcare environment? Because that would be his learning curve. He would know sort of the cybersecurity stuff, but you'd want to familiarize himself with the nuances of healthcare. I've heard other CISOs talk about rounding, that
Yes.
they, being in the, go to Gemba type thing, be in the facilities to get a sense. I've heard CISOs talk about the importance of even, and this has to do with remote work versus coming into the office, with talk about the importance of even security personnel coming in to the facility to be connected to the patient care mission, to understand what they're securing so they feel connected to it. What are your thoughts around that? And the idea of, again, familiarizing someone who's not in healthcare with the healthcare environment.
Yeah, no, I'm a big believer in rounding. And, Rishi certainly has come on site. He's rounded in the clinical areas, as has the cyber team. And, he also, worked, tremendously hard to create relationships, whether it was with the presidents of the hospitals, whether it was, with our research community, our School of Medicine. He really has, made a tremendous effort to learn about the business and, form those relationships. And he's done extremely well.
Now, you seem to me like every CISO is going to have a different level of comfort and familiarity with cybersecurity. You seem to me like someone who's got extreme confidence, knowledge in the cybersecurity area, somewhere you're very comfortable playing. I would imagine that there's a scale for CISOs. Some are less, some are more hire the CISO and then hands off. But what are your thoughts on the optimal CIO CISO relationship?
Yeah, I think the key is trust. I trust him. I think that he has the ability to, proactively identify risks before they become issues. He, resolves, any issues that we see on a timely basis, and he escalates to me when appropriate. I think that he has a great balance in terms of, from the strategy perspective that he and I work on together, but he's able to, really deep dive into issues. So that ability to do that, I think, is extremely important. For me, I think cybersecurity is, one of my number one priorities. A few years ago, I went and did a CISO certification at Carnegie Mellon. And it was a 6-month course. I felt that it was important for me to understand, how we would improve our security risk posture and what we needed to focus on. So I think the CIO also needs to, have some background and education in cybersecurity, because it's a really complex area. And, I think, making sure that the CIO is still involved, make sure that, you're assisting to drive resolution. And you have to stay aware of cyber trends. And most importantly, be a champion for cybersecurity to get the support and the funding and ultimately the compliance in the organization. So I'm a big champion of cybersecurity.
Is there a dynamic sometimes where the CIO, especially if they have innovation under their belt, you have digital under their belt, could you have a CIO sort of pushing things forward and the CISO being the one that has to make sure security is injected? But you probably would never want a situation where a CIO is not thinking about security as much as they should. That's probably not
No,
optimal.
no, it's not optimal. To me, you have to move quickly with
Mhm.
digital, but you always have to make sure you're secure. You
Right.
can't be putting out products to our patients that are not secure or, have a risk in some way, shape, or form. And so, there is a balance. But as I said, my aim with the cybersecurity program is to ensure we're not an impediment to the business and, speed to market and growth. And, so making sure that we have the appropriate procedures, we can escalate, we can prioritize and make sure that, we're really focused on, what is going to reduce risk for, our patient-facing applications or products. I think they have to be a high priority in any cyber reviews, and they are.
So time is an issue, but you need a certain amount of time to review applications that are requested. So
Mhm.
it's going to take some time, but
Sure.
you don't want it to be excessive, right? You don't want it to be seen as this black hole where we make a request for an application and we don't hear back for 6 months,
Right, right.
right?
And the way that you do that is by maturing your third-party risk management program. And, it comes sometimes down to resources. It comes down to processes and, ensuring that you're prioritizing accordingly. And, we also use beyond trust. And so that also has, vendors that have already been pre-certified.
Mhm.
Now, that helps us in, our clinical and corporate world. It doesn't necessarily help us for our research world, where we get a number of applications that, are extremely novel, that, we need to be able to, turn around quickly, so that we're not an impediment to the research moving forward. So, it's a balance.
Yeah. Do you want to talk about maybe a couple of things that you're working on? And this could be on the security side, but it doesn't necessarily have to be. Just a couple of the big picture things that you're working on.
Sure. So non-security related, we took a step back and, started looking at our overall digital roadmap for the next 3 years. I think that, we have, a number of digital capabilities, but looking at it from a different perspective, from an experience perspective for our patients and employees, and ensuring that, we're having more of a seamless and frictionless experience. So that has been an ongoing initiative for, the last 6 to 7 months, where, we've really taken a look at our, technology, our foundation, our application portfolio, and, what are the products that we want to develop that we believe will differentiate ourselves in the marketplace. So that is, and it has been a huge priority for us. I think secondly, cybersecurity is always going to be, a priority in this organization. So, we're looking at, maturing our capabilities, making sure we can recruit the right talent for the organization. And I think, our engagement with Sandbox is an example of us being able to, improve existing capabilities, but proactively address a concern that could grow in the future. Look, I think that the trends in cyber, continue to be disturbing, right? I mean, we've got the Ukraine-Russia situation. There are many cyber risks that, present themselves. And I think that, making sure that, we're monitoring that very carefully. And then, the next generation technologies. And, we think about, our migration to the cloud. And it presents a risk and an opportunity simultaneously. And, we need to make sure that that entire transition that we're also going through with Microsoft, that we manage it carefully from a security standpoint.
You mentioned about looking at your digital roadmap, and it made me think of governance. It's it's everything, right? Because as they say, there's a million things you can do, but there's a finite amount you can do, is a finite amount you can afford to do. So do you want to talk a little bit about your governance process and the importance of having a sound governance process so you stay in lockstep with what the business really wants?
Oh, yeah. So, I think that, the health system strategy has to drive, any of the work that is going on in the technology organization. So it's important to align that at all times. So our sponsor for all of the digital work is our president and COO, and who oversees the strategy for the organization. And we make sure that the digital structure that we are now putting up is in alignment with the existing structures that are already in place. So we have a business innovation council, and we want to make sure that we're not replicating some of the work that goes on within those councils. So we created a digital portfolio review process, and we also created a number of committees and, rationalized, quite frankly, a number of committees that were out there, because, you don't want to have, conflicting charters or missions for the committee. So governance is extremely important. We've gone through this process, and now we're standing up our structure that has been, reviewed by the executives of the organization, and they're very supportive of it.
And you mentioned the cloud, and I've heard CISOs discuss the idea that maybe there's some things that need to stay on-prem. So what are your thoughts around the cloud? There's all different types of cloud arrangements you can have. So there are many options there. And then again, the idea that some things may not belong in the cloud at all.
Right.
What are your thoughts around that?
Yeah, so, we recently, formed a strategic relationship with Microsoft to move, the majority of our application portfolio, off campus to the cloud. And, you're right, there are some areas that, shouldn't move to the cloud. So a great example would be, our supercomputing infrastructure. We're not going to move that to the cloud anytime soon, probably not even in the next 5 years. That's going to remain on premise. There are also applications that, we can't move to the cloud. They're not ready. They're not cloud ready. And, we're using cloud as infrastructure as a service. So, and then you've got other vendors that are software as a service that we're working with, such as an Oracle or a UKG. So, I see that, there are multiple buckets, but you're right, there are going to be some applications that ultimately don't move to the cloud. And, we'll continue to have an on-premise data center that, they will be located in.
Yeah, it's like when everybody wanted to get rid of paper completely. That didn't quite work, right? I mean, it still hangs around. And the same thing with the data center, right? Well, there's the dream for a little bit of everything's going in the cloud, but maybe not.
Exactly. I mean, we'll have a hybrid model, and like most organizations.
Speaking of hybrid, let's talk a little bit about workforces, hybrid remote workforces. I think everyone is working through this to get folks back in the office a certain amount of time, perhaps not every day, but some sort of arrangement. Where do you stand on that? And do you have an overarching philosophy about having folks in, or maybe not?
Yeah, we have a very flexible work environment. The majority of our team is actually working remotely. I'm in the office, at least 4 to 5 days a week. And, some of our leadership team is. I think that for certain projects, it's great when people can meet on site and really work together to solve a problem. Sometimes it's difficult on Zoom to get that traction. But overall, my philosophy is, flexible working environment. And, I think that that's there to stay. I know that not everyone agrees. I know that, some hospitals have, brought in the team members to work sometimes 3 or 4 days a week. But I don't think we'll be adopting a policy like that in the future.
When I talk to people about this, I hear a lot of what you just said about executives saying, well, I come in, right? I come in 4 or 5 days a week, but a lot of folks don't, that are maybe lower down on the ladder, so to speak. Could that create a problem long-term of a 2-tier type thing? I mean, if all executives want to come in a lot, but they don't need their teams to come in a lot, do you see any issues there?
I personally like to see people.
Yeah.
I think it really comes down to, traditionally how you've worked also. I like to be able to, pop over to, some of my peers and, talk to them for 5 minutes rather than trying to set up a meeting that could take 3 weeks to get
exhausting,
on the box,
right?
right? So I think that, for me personally, but at the same time, I don't want to impose what works for me necessarily to, the entire team. What I hear from the feedback from my team is they really appreciate the flexibility. So if they want to come in, and they certainly do, many team members do come in, but there are others that, can't come in. Either, they may have, a health issue. They don't want to get on the subway or the train necessarily, especially as, the rates are increasing.
Yeah. Yep.
So we just got our alert raised here in New York City. So I think that, flexibility is really important. And you have to also get the feedback from your team.
Yeah, and I spoke to another, it was a CISO who was really good with remote work, no problem, but said, if we have an incident, if there's a breach, and I think then I may want the team together on site to work through. Do you see it that way, where, okay, we can have flexibility, but if there's an issue, there's, as you mentioned, sometimes you can't have the interaction on Zoom that you need to get people in a room to
And
work through.
we did that
Yeah.
recently. Yeah, that's a great example. I mean, we've got Epic Hospital Billing that is underway. As you can imagine, you've got, many parties. You've got, the finance team, you've got Epic Wisconsin, you've got our team, and then you've got, other groups from operations. And so, we've been bringing team members in. And, working, together on specific issues or decisions that need to be made. And we found that, in that particular case, people were solving issues, quite rapidly when it would take much more time on Zoom. Right. So I think for specific projects and for specific circumstances, it definitely makes sense.
So everyone has to be reasonable, right? If you
I
get
think
flexibility as an employee, you get lots of flexibility, but when we need you here, come on in.
Yeah. We also have remote team members out of state now. I think that that's, the one, advantage that, we were able to recruit team members from all over the country. But when you have that circumstance, when people are permanent remote workers, you cannot, ask them to come in,
Right.
if they're living out in California. So I think that, again, I go back to flexibility, listen to your team, listen to what they're saying, get the feedback from them and what's important to them.
Yeah, so you're in New York City, so that's got its benefits, it's got its drawbacks. You have a lot of folks there, but again, having them all there is not as important as it used to be. You can hire people in California, but people in California can hire people in New York.
Right.
So
Exactly
it's
right.
a double-edged sword, right?
That's
so
exactly right.
I mean, overall, what does being in New York, what are the positives and the challenges there?
Yeah, look, I think that New York is recovering. I think that it's changed the way, though, people work. I saw a newspaper article in the last few days where it said, only 8% of, office workers are coming in regularly, like, a 3 to 4, 5 day work week.
Right.
So I think that's really changed the city. And, the way that people used to commute in and spending their time. On the other hand, I think that, it's given people that flexibility. So, you can take your child to school, you can pick them up, etc. So, again, I go back to, flexibility is really important to us.
Well, that's about all I had for you today. I would like to give you an opportunity for a final thought, a final piece of advice. It can be around the sandbox deal. It can be anything in general. Just best tip you've got for your colleagues who are working through a lot of the same issues that you are.
Sure. So I think, to CISOs, I think, make sure you're focusing on, protecting the digital value of your organization and, prioritize by protecting key revenue streams. And I think to CISOs, get a great understanding of cybersecurity and stay vigilant, stay ahead of the curve as much as you can, and invest in this area before it's too late. So I think the need for a mature and advancing cyber function is imperative. You have to keep your health system and your patients protected.
Yeah, and I think your point about you going back and getting that extra education, that 6-month certificate on cybersecurity as a CIO, is a good message for your colleagues to say, hey, you might have a great CISO, but you still need to understand this stuff, right?
Yes, absolutely.
All right, Kristin, thanks so much. Wonderful chat. I really appreciate it.
Thank you.